Say I'm a patient, I'm needing questions answered. What do I do? Do I just go to the PocketRN website
Yep.
and click on the contact a nurse button? And then what do I expect to happen from that point forward? And how does
Yeah.
it tie in with my insurance or out of pocket costs? Like, what does it actually look like day to day?
So, in terms of how to access the care, we make it really easy because we actually, most of our patients are the aging and elderly, right? And so, there are a couple different ways you can access care. You can log into the app and log into your profile and meet with the nurse that way. But we also have a wonderful support team. They're really awesome that you can just contact, whether on the phone or via text message, and they can also help facilitate getting you on a meeting, either right now if you need it on demand or scheduling ahead of time. If you have a nurse that's your nurse for life that you're used to meeting with, you can schedule those visits with them as well.
Mhm.
So in terms of the actual like receiving care as a patient, it's pretty easy. We make it so that you can kind of access it a few different ways. The other thing I really love about it is that we also have caregiver profiles, because
Mhm.
sometimes the person who's really driving the care and making sure their loved one shows up to appointments is a spouse or an adult child or something like that.
Right.
So we
That's
create
really good.
those caregiver profiles, yeah, so that they can schedule on behalf of the patient, or they can, initiate and start a visit on behalf of the patient. So that's another option as well. And then in terms of your question about kind of how does it get paid for and things like that. So it really depends on, we have partners across the country. So it kind of depends on what service you're kind of a part of, right? So
Mhm.
for some of our like hospital-based programs where we're providing support when they're transitioning, like post-discharge, and they're high risk for readmissions and things like that, the patient is not the one who's being charged for that. It's like it's a program that the system has actually contracted us to provide. So in that
Oh, okay.
situation, they don't have to worry about their copays or anything like that. In programs like Guide or other things like chronic care management, it's kind of based on their insurance. They enroll and consent into the program, and think they have to be eligible and things like that. So in their different codes. But I think the reality is that these nurse-led services is that there aren't a ton of options available in kind of the traditional way that you bill for services that we currently see in healthcare.